Well, happy Sunday, everyone. This is Dr. Yonnette coming to you with another episode of Baby Talk. A brand new week, brand new opportunities to have experiences with your baby and see him or her grow and achieve skills that you would be so pleased to see. So today I want to revisit our biting episode that we talked about last Friday. And I think it's appropriate because I had another parent come to me about his child who has been biting. And so I want to share with you today a protocol that you can use as mom or dad or your daycare can use so that you can help your child through this experience. I want you to know, though, as we begin the discussion, that biting is normal. Biting is actually normal in toddlers because, like we said before, the way children explore, young children and babies explore their environment is by putting things in their mouths, right? They mouth toys, they mouth whatever you give to them. And so toddlers now would have experiences of biting, and I want you to know that these experiences are normal. Normal to the extent that the toddlers are dealing with a lot of undeveloped skills, emotionally. When they have certain emotional feelings, they are not able to convey those feelings because they don't have the vocabulary to do so. And so they resort to the quickest way to get your attention and to make sure that you know exactly what they want. And when we are talking about children who are nonverbal, it makes it even more, understanding that you would see a child biting. Now, is biting acceptable? Of course not. We do not want our children going around biting everybody in their world to get their way. So hence the protocol for you today to help you through your experience if your toddler is biting to get attention. So let's talk. Let's talk about some don'ts. Some don'ts before we address the protocol. Do not punish. Do not punish the child to stop the biting behavior. Do not punish the child to stop the biting behavior. Do not have a big reaction to the incident. Oh my goodness, he just bit her. And your arms are flaring and your hands and your voice is loud and you are so hyper about the whole experience. Do not have a big reaction to the incident. Stop what you're doing. Do not stop what you're doing, rather. Do not raise your voice. Do not get into the toddler's face and use lots of arm movements and animation. Do not. Do not teach why it's wrong for the toddler to bite immediately following the biting. And the nose of all knows. Do not bite the toddler to show him what biting feels like. Take a minute and let those do nots sink in. Reflect on whether you are guilty of doing any of those when you encounter incidences of children biting in daycare or biting their siblings at home. So now that we have talked about the do nots, let's look into what an appropriate protocol will be for a child for addressing a child who has biting issues. Number one, you want to stay calm. Stay calm. Get down to the child's eye level and use a calm voice, minimal facial expressions, and limited arm movement. So you want to be as nonchalant as possible, using that calm voice. Don't let your face reflect the anger and then start flaring with your arms. So be calm, use a minimal facial expression and a limited arm movement. You want to state what you saw happen and what emotion the child might be feeling. Say, I can see that you are really angry that Ben took your toy. It's okay to be angry, but it is not okay to bite. Then move the toddler away from the person he or she bit and say, I am going to move over here because you are not safe and Ben is not safe to play with you right now. Simple as that. That's your protocol. Stay calm, get down to the child's eye level, use minimal facial expression, use a calm voice and limited arm movement, and then just state exactly what you think the child is feeling. Move the child away, and after about 30 to 40 minutes or later on in the day, when the child has calmed down, you want to talk to him about what happened and identify other ways that he can manage his emotions. So this is what you can say. I could see this morning that you were really angry with Jack because he took your toy. Let's think about other ways that you can tell Jack you want to play with that toy. You can say, stop. If the child has no language, she can or he can just use the sign. Or you may have a stop sign that you can give to the child to hold up when something like that happens. If the child is able to use words, the child can say, I'm playing with it. It's my turn. I'll give you the toy when I'm done. Now you also want to say, if Jack does not listen when you say those things to him, I need you to come and get me and I'll help you deal with the situation. Additionally, you want to create a similar scenario, and role play it with the child. Sit on the floor, pretend to be Jack, then grab the toy from the toddler. Say, let's practice what we just said. The toddler should say, stop, because you're role playing. And then you want to, throughout the day, you want to praise the toddler or the child when he uses the skills that were taught throughout the day. Be specific, though, when you praise him or her. Say, Ben, that was great waiting. I can see you are waiting until your turn. Jack, you did really well at telling Ben stop because you were still playing with the toy. Use the exact things that the child has done. Praising the desired behavior will likely increase the use of the behavior by the toddler. Now, you want to also be aware that biting increases extremely high. You'd have extremely high increases in biting, or it's extremely common that biting will take place when the child is tantruming. So you want to prevent those instances where the child will fall into a state of tantruming. Okay, so that's your protocol for biting. That's your protocol for handling a child, a toddler who has been biting to express his emotion and his needs. So take it, work it, let me know how it worked for you. As we close our session, I want to talk a little bit about taking care of you, moms and dad. Today is Sunday, the best day to take care of you. I know you're going to be rushing around doing all the house cleaning and getting ready for the new work week, but I want to encourage you to take some time for yourself. So what will you do? Take care. You know, I advocate taking care of your skin. So here are 2 skin products that you can use. You can use the oops, I have it upside down. You can use the hydrogel mask, the biocellular mask, which is an awesome coconut mask that gives your face the moisture that you need. You can use the hydrating mask. And of course, all of these have to be used after you do a cleanse. You can do a chemical peel. Yes, a chemical peel that goes a little deeper than the surface and really gets rid of the dead skin. You can do a pink clay mask that adds moisture to your face. And both moms and dads can benefit from that, from these products. And then you can add this award-winning line reducer and moisturizing chemicals, or clinical solution products, I should say, to your regimen after you're finished masking and you apply your moisturizer. These are 2 great products to add to taking care of you today. Taking care of you today. Also, take care of baby. We haven't had a playtime with baby in a little bit. But set baby up today in the tub, add some bubbles to his tub, and add some toys. And play a baby find as you take care of baby. Baby is reaching and grasping and holding and moving things back and forth and looking, using his eyes, looking through the water as he finds the objects that you have hidden. It's such a wonderful, precious time. I've seen baby AJ turn 4 months recently. Baby Dominic turned 4 months old. And I'm seeing some precious little ones coming out and having a good time as moms and dads take care of them. You know, I am so happy that you have partnered with me to help raise your little one, your precious bundle of joy. And it's my pleasure to share with you my knowledge as an occupational therapist who has worked with a number of children, normally developing children, children with disabilities, and of course my own children. Thank you for joining with me today. This is Dr. Yonnette saying, have a fantastic Sunday. Take care of baby and take care of you.